Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast podcast today. My name is Terry Fletcher. We are at the 128th episode of the CodeCast. It is the last Tuesday of March, so this means we are at Top 10 Tuesday. So I hope everyone's staying safe, staying home as much as possible, and not going stir crazy with your family. I even Skyped my family up in Oregon, and now I realize why I like living in California. They're going to love me when they listen to this. If they do, sometimes they don't. But each week now, it is really tough for healthcare professionals, especially those of you that are not used to staying at home and working from home. And issues are coming up with how healthcare professionals are managing in this tough public health emergency time. So I wanted to give you some expert and practiced tips on working from home, just some insight. I hope this helps, but it is something that I think hopefully can help you and maybe hopefully get you through the pandemic from remote working situation. Again, especially if you're new to it. So if you already work remotely and you may find some wisdom here, I think that's great. So hopefully it'll help you at least enjoy the process a little bit more. So number one would be to create a designated area for your workspace, or what you may call your home office. Even if you don't actually have an extra bedroom or a den or an area that can be closed in like a bedroom can with a door, since you're in healthcare, it has to be a space that you can actually close off to other people in that space. So it needs to be HIPAA compliant, meaning protecting the privacy for any patient information that you may receive that's out in the open, or that somebody could hear you talking on a phone call. That has to be also considered. And not accessible by anyone that lives in your home or comes into your house. Hopefully at this time that's pretty minimal. It should be password protected computer, so locked file cabinet so that you can put any, again, patient information that you have taken home, and a desk or a table that's designated as your space. So hopefully some of you that had to come home and work from home, you don't just have it spread out all over your bed and trying to deal with it that way. You need an area each day that you are not just taking it down to set the dinner table or to make your bed or to work on a puzzle. Anytime someone could come and check on this space, and it has to be compliant. And so just make sure you have a designated area for that. Number two would be create a workflow for you that will keep you on task. That's probably the hardest thing. You want to make sure that each day you have a list of those tasks so that you can, and any notes surrounding that task so that you can stick to it. Make sure you're also adding the time blocks dedicated to that task so that you can stick to your schedule. So maybe you're an auditor and you're going to do 2 hours of auditing. Maybe you're a scheduler and you're going to do 2 hours of that. Maybe you're a coder, and I would think with the CodeCast, many of you are coder and biller, and you're going to work on your coding reports, or you're going to work on your appeals. But make sure you have specific timers for that, because you're going to hear the dryer go off, or you're going to hear one of the kids who are at home saying, "Mom, come watch this with me," or, just something that you're going to want to get up and go empty the dishwasher or something like that. And you must stick to your work time schedule. There's time for that other stuff, and you want to make sure that in that schedule you add in breaks and a lunch break, but you are at work. Make sure that your mindset is that you are at work just like you were working when you go into work. Speaking of the kiddos, and let's put husbands, partners, wives, and significant others in that category as well, of who are in the background when we're trying to figure this out. But they think we're on an extended Bahamas vacation when we're working from home. They don't realize we're actually working. So I remember with my daughter's dad, when we were married, I would be traveling so much back then when she was younger. And it was like he thought I was on vacation. I would much rather be home with my family than be traveling. But the same thing when working at home. There needs to be some kind of a family meeting, and let them know and have them buy into it and get everybody's vote. But the only vote is, yes, Mom, we're going to do what you say, or yes, Dad. But basically what you're saying is that since you are in the healthcare field, your job is still ongoing. Luckily, I mean, you have daily work and it's just from home now. Your location has changed, but you can't tolerate the interruptions, and they would have to be at a minimum, and only if it's an emergency and it can wait. And if it can't wait, then you can be interrupted, but you might want to give a suggestion of what those are. Otherwise, you will have your kids playing dress up or deciding they want to look like a certain celebrity and putting makeup all over their face, and then coming in your room and saying, look at me, look at this. Same with partners. They like to do the same thing and do cartwheels behind you. So just make sure that you have put some boundaries on that. Otherwise, it's going to be really hard for you to be professional. Which brings us to number 4. Nothing is your friend like your mute button. Nothing kills a business meeting or a conference call or a webinar or an interview or a podcast more than background noise. And noise is not professional. You're going to cut some slack from people who right now find it kind of amusing, the situation we're in when it comes to working from home. But most will just find it annoying, and you can't control your and if you can't control your surroundings, and that you are not tech savvy enough to know what mute is, you may have some people get upset. The other thing that happens sometimes, and I was talking to this with a colleague of mine, if you have all of a sudden gardeners that just start to do the lawn and the mowing and all that outside your window when you're trying to do a webinar or anything like that, you're going to have to put yourself on mute and immediately change locations. Apologize to your audience if you're doing a Zoom meeting or a GoToMeeting or a WebEx meeting, and just say, we just had some background noise. Let me put you on mute for a second. Give me 2 minutes. I'm just going to stand by, and I'm going to go change locations. You have to be ready for that. So make sure that you have a backup plan. But the background noise, the background chatting, if you're doing a lot of meetings that are visual, nobody needs to see everybody doing cartwheels behind you. It's cute for a second. It's not cute after that. And then establish your work hours. Now, I talked about making sure that you keep on task and making sure that you have certain time frames for certain things that you do. But it may not be the 8 to 5 that you have at your brick and mortar job, but you need to have set office hours so that your family knows when you're in work mode, your clients know when you're in work mode, your office, your physicians, and the patients. I'm finding in all of this sequestration or quarantine, whatever you want to call it, people think that working at home means you have to be available 24/7, weekends and evenings. And unless your job description is required to do that, that's not what that means. Now, of course, I'm a consultant, and so I work for myself. And so I have a lot of physicians calling me and emailing me or texting me on Sunday. I'm not really sure why I gave them my phone number that way, but they're getting me on Sundays. They're getting me at 10 o'clock at night, and everything seems to be urgent. As an employee, that's not what you do. Unless your salary reflects that, triple digit salary, that 6 figures, that is not who you are. You need to make sure that you have office hours and make sure that everybody respects that. Also, do not check email past your closed hours. Work text can wait till the next day, unless, again, it is an emergency. Because remember, if something is truly an emergency, you're going to get a phone call. I know even nowadays when I get a phone call from somebody that usually doesn't call me, I'm like, what's wrong? So you will get a phone call if it's really something you have to take care of right now, but you have to be respected for your office hours. Number 6, okay, this one, I think all of you are going to be like, oh my gosh, she's so right. Stay off social media during your workday. Unless you're on your lunch hour. It's a time suck, you guys, and you could think you're only checking Facebook or Instagram or Snapchatting with your friends. I don't know how to do that. But the other two, and all of a sudden you could think you're checking it for 5 minutes, and then all of a sudden you've wasted an hour. And it's not fair to you or your employer who is paying you, or your family who may want your downtime when your work is finished for you to do that. So save social media for your evening downtime, after work, after dinner. Kids are down, or they want you to watch, their video for the 10th time this week, or when your husband's playing video games, or your partner is, gardening, or when somebody else is doing their own, relaxation mode, and that's something you do just to catch up on what's going on in social media. And of course, nowadays with everything that's talking about COVID-19, as much as we need to stay informed, it's everywhere. So you might want to take a break from it, but stay off it during your workday. And then number 7, you might find this one kind of funny, but you might not. Make sure you have a desk calendar, because I've noticed that people are forgetting what day it is. My daughter, who is an 8th grade English teacher, she's working remotely now with the kids, and she's basically doing her lesson plans and putting them up on the whatever access they are on their education site. And all of a sudden, I know she said a couple times to me, "What day is it?" I'm like, "Seriously, Summer?" And she's like, "Oh my gosh, being at home, it's like the days all run together." She goes, "The only thing I get out of the house for is to go to the garage to get on my treadmill." She goes, "And then I come back and I'm doing the same thing." And I've noticed that people especially who are not used to working at home, they're having the same mind lapse. So make sure that you are doing that, and getting a desk calendar. You need to know what day it is. And I know a lot of you do look at your phones, but do you actually look and see what time and day it is? Not really. And I should have put this as number 1, well, at least hit not top 10, but get ready for work as you would have if you're going to the office. That includes taking a shower, brushing your teeth, getting dressed, doing your hair. It seems people have forgotten all about personal hygiene at home during the pandemic. The biggest rush 2 weeks ago was wash your hands, wash your hands, wash your hands. And now it's about, well, I'm home now and I'm with my family, so it doesn't matter. And I've seen people say, I went from my daytime pajamas to my nighttime pajamas. I'm like, did you get a shower in between that? So when you're out and about, I know the hand washing got better. But if you're in a Zoom meeting or you're in a go-to meeting, and I was in 2 meetings recently, and I saw people in their pajamas and they look like they just rolled out of bed. It's really disturbing to me. You're still a professional. Let's keep it professional. Remember, this is temporary, but at some point somebody could say, "Hey, can we do a quick video call?" Because they don't like the phone thing. And so you'll be like, "Oh shoot, I'm still in my pajamas, or I haven't even brushed my teeth yet." Don't do that, because I noticed that, especially if you're somebody that gets up and works early, you can get up, put your, in your pajamas, just put the coffee on real quick and say, "Okay, I just need to go do this." That's always a mainstay. I just need to go do this. You go into your office at home, walk across the living room, and then all of a sudden what was 7 o'clock is now 11 o'clock, and you still haven't brushed your teeth, still haven't taken a shower, and now you're stuck to the chair in your office. So make sure you're still getting up and getting ready like you are going to work. Number 9 kind of goes with what we were talking about as far as making sure that you have work hours, number 5. But number 9 is about closing up at a reasonable hour. Even if you live alone and think, you know what, I'll just keep working. Unless, again, you're a consultant or an entrepreneur like myself I tend to work 12 to 15 hours, especially with all this telemedicine stuff. And sometimes at days, keep your workday to 7 to 9 hours, depending on your employee contract. When you close it down for the day, also pack it up. Wipe everything down, hopefully using some kind of cleaner, put things away, lock drawers, put things in locked drawers, log out of systems, and make your designated workspace look ready for the next day. Not like a cyclone that you need to sift through the next day. Pretend you have housekeepers or janitorial staff, somebody coming in and you don't want them seeing anything on your desk. Also, it's really a great idea to, again, take some of that industrial strength cleaner that I'm sure everybody's purchased at this point and wipe down anything that you've touched, worked on, had coffee on, eaten over. Wipe down your computer keyboards, because those are warm things and they're, any kind of bacteria can live in them. Make sure you're wiping down door jambs, door handles, anything in your workspace so that the next day, anything you touched, you're fresh and clean to go. Number 10, step outside a minimum of 15 minutes a day. Do it as one of your breaks that you take. If you start at 8 and you're taking a 10 o'clock break, step outside. Most of the public seems to think that, self-quarantine means that means housebound and that you can't even walk outside, and that's not what that means. You're allowed to go for a walk with respect to social distancing. Walk your pets, walk with your kids, relax with relax your eyes and your mind and just breathe. Even if you just want to sit outside, even if it's cold or raining, just get outside for a few minutes. For those of you that still have snow, I hope that's nobody. We're into spring now. I'll cut you guys a little bit of slack. You can always take a window break, but you need it. Take those breaks. Don't be stuck to your chair, okay? And I've really forced myself to do that. I'm actually going into my office for work because I'm considered an essential business, and so the city has given me a bypass on that. So I actually go into work. I can do 50% at home and 50% at work, and so that's what I'm doing. But I just know that you have to take that break. And so I hope these 10, expert tips and insights really helped you, because I know navigating through this process it's really kind of frustrating. And I've noticed that my day really hasn't changed much. I go to work, I come home, I do my thing. And so it's interesting when I see everybody else really struggling with it. But the thing I have noticed is that I'm feeling a little bit more bored, and I'm feeling a little bit more, and I don't know how you do that when you work as many hours as I do, but I'm also feeling like a very closed in, just because you can't go to a restaurant, you can't visit your friends, you can't go out for, a glass of wine or whatever for happy hour. And so when you're told you can't, that's definitely where it tends to kind of hit you in the face a little bit. So hopefully that helps. So our coding question today, and I'm actually glad this came in, because as I was talking about telehealth for the last, who knows how long, at least 12 days, there have been changes every single day. So one of the questions says, Terry, can I bill a new digital online E&M service to the Medicare payer? So this question came up, and last week when I had my podcast, it wasn't billable, just so you know. And I usually record the podcast a couple days in advance. And so as of May 20th, when it finally came out on a fee schedule, Medicare added it. So as of the 23rd, it was payable. Then what we're talking about are the codes 99421 to 99423. What these codes are these are patient-initiated patient portal visits. So, for example, Epic has something called My Chart in it. NextGen has something like PPT Patient. And that's where the patient can access their portal. So they're basically part of their record, and see a test result and ask a physician or a provider a question. And what these codes provide, again, is they call it a digital E&M. It's not a phone call. It's not a video chat. But these codes cover 7 days of cumulative work by your physician or mid-level provider, meaning that once they get the patient portal email, and again, it's not a phone call, they take the time to review a test or find the answer for the patient and then respond to them. And anything they do within a 7-day period, hopefully they get back to them in a couple days, but it's cumulative up to 7 days. So you can't have one for more than once every 7 days. Then you can code the 99421 to 423. They are time-based codes, and reimbursement ranges anywhere from $20 to $50. And your place of service still is O2 because it is a telehealth visit. But just make sure you know that time needs to be documented so you know what to pick. And there is a copay to the patient, but it's up to you whether or not you're going to bill for that copay just during the PHE, which is the public health emergency. And that's one thing for all copays right now. You're seeing on TV, and even the president said it, which I wanted to flick him. But everybody's saying this, where basically there's no copay or out of pocket for the patient. The reality is on the telehealth services is that the copay is still going to be taken out of your EOB. But the HHS department, so the Health and Human Services Department, which is also an extension of the OIG, they are not going to penalize you or sanction you if you choose to waive it during the patient or the public health emergency time, which started on January 31st, 2020. So just so you know, for service, and it's really for services after March 6th, and we don't know the end date yet, but it is illegal to waive a copay or deductible under a government program. And so now they're saying that if you do during this time, again, temporary, then we won't basically get you in trouble. So that's what they're saying. They're saying, yeah, you absolutely can waive it, and you don't get that money. So you're making the decision to lose the money, and you don't have to lose that money. It's up to you. Our coding question was brought to you today by Arch Healthcare Escondido, home to 15 plus specialty providers, including cardiology, electrophysiology, orthopedic surgery, and bariatric surgery, to name a few. Get connected. Arch now offers patients a simple way to manage their healthcare through their EMR patient portal options, archhealth.org. So make sure that you also have checked on my website for the on-demand webinar on telehealth. I update it. It seems like every day, but there are slides on there and information on there for you so that you could do it correctly. And also I have updates to my blog, again, daily on the telehealth dilemma or nightmare or direction, whatever you want to call it. It's been an ongoing headache for, I know, a lot of you. So I wanted to end my personal insight this week about, obviously everybody's washing their hands, but just also make sure we're getting a lot of things delivered to our house through UPS and the United States Postal Service. And so make sure that you're washing your hands after that. But I have a funny story. So I love to buy my daughter clothes. She's just a very cute girl, 5'7", dark hair, blue eyes. She's just a cute girl. And so I'm always buying her some new clothes, or a bikini or a bathing suit, or needs new blouses or new outfits for going and being a teacher. And she's like, yeah, am I going to wear those now? I go, get ready for work. She laughs at me. But I bought her one that was a dark blue shirt, and I noticed that she had it on the other day. I'm like, oh, that looks cute. But then I looked at her arms and her hands, and I'm like, why are you bruised? And she's like, what are you talking about? And she looked down at her hands, and apparently the shirt had some dye issues or was coming off. And then she touches her face, unfortunately, too often, and I could see it on her face. I'm like, oh my gosh, take that shirt off. We have to throw it in the washer with a dark colored towel. That's how you get the excess dye out. And then it was fine, but it was kind of a funny moment because it was all over her. And she's like, thanks, Mom. Appreciate the new shirt. And it was Macy's. I buy good stuff, so I couldn't believe it. But anyway, just a funny story. I'm looking at her going, why are you bruised everywhere? So that was funny to me. Also, don't forget to check out my new Business Collective podcast on all platforms, and leave me a rating and review if you can. It dropped last Monday. It drops every Monday, and it's for those of you that want to go from employee to consultant or to entrepreneur. Listen in. And even if you're just thinking about it, I'm pretty excited about it. I've gotten some good reviews so far, and it's just a fun podcast to do. So I'm pretty excited about that. All right, everyone, on this Terry Tuesday, make it a great day and a great week. And thank you for listening to the CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.